Welcome, everyone. I don't know if I've ever been as excited about an interview as this interview. We have a legend here, Dr. Simopoulos. She's an American physician, researcher, author, and founder and president of the non-for-profit educational organization Center for Genetics, Nutrition, and Health. And she's written many books. And when you see research about the omega-6 to omega-3 fatty acid ratio in texts, in journal articles, you'll always see her name, because she's the leader in this area. So welcome to the show. Thank you for making time for us. And I couldn't be more excited to have you.
Yeah, I'm very pleased to be on the show. Thank you.
Yeah, and now let's just start at the top. We're going to get into something that I think is very important that most Americans are missing. And like you said, you're traveling worldwide now, spreading the news about this. But what initially sparked your interest in fatty acid research?
Well, I used to be in the intramural program of the National Institutes of Health. And at that time, I was very much interested in metabolic changes and how they affect the growth of children. And one of the areas that we were focusing at that time was in a disease that has the name of Barter's syndrome. And that was the laboratory of Dr. Barta, where I worked. And so we received references and from all over the world, patients who were considered to have this metabolic syndrome. One of the aspects of that was prostaglandins. So I focused on prostaglandins and specifically on the nutritional aspects of prostaglandin. And at that time, there was a group in Italy that were also interested very much in prostaglandins. And I attended the conference that they had in Florence. And I realized that there's just so much on the nutritional aspects of prostaglandins, a lot more than I thought was applicable to patients with Barter's syndrome, that I decided to focus on it. And then I realized that the people in Sweden, and in fact, they got the Nobel Prize for it, had focused in identifying the various prostaglandins and their entity, and the fact that they came from fatty acids. So that's how it came about.
Oh, beautiful. So tell us, what are prostaglandins? And what was this syndrome? What were the consequences of this syndrome? So how did that tie together for you?
Right. So, you have heard about saturated fats and polyunsaturated fats and monounsaturated fats. But the polyunsaturated fats come in two different families, omega-6 and omega-3. And they are essential because the human body, cannot make omega-3s from omega-6 or vice versa. So that we have to get them as such in our diet. And some of the sources of the omega-3 fatty acids are green leafy vegetables, which actually I specifically did that research when I discovered that purslane, which is a very primitive wild plant, has the highest amount of alpha-linolenic acid, which is the omega-3 fatty acid. So I then, after that, I began to really focus on it. And I used the diet of Crete as an example, because the people in Crete, they lived the longest and they had the lowest heart disease since before the Second World War. So I figured it could not be just the olive oil. It has to be other factors as well. And so I began to do a thorough analysis of the diet of Crete. And that's really brought me more and more then into looking at the specifics of essential fatty acids. So let's start with the omega-6. The omega-6 fatty acids are found mostly in vegetable oils, like, for example, sunflower oil, safflower, corn oil. These are oils that became very popular after the Second World War. The omega-3 fatty acids are found mostly in the leaves of green leafy vegetables and in the seeds of flaxseed or chia seed. Practically every part of the world has a seed that is high in omega-3 fatty acids called alpha-linolenic acid. So we refer to them as the parents of the fatty acids. The omega-6 is called LA or linoleic. The omega-3 is called alpha-linolenic or ALA. So through different enzymes and various metabolic steps in the body, the omega-6 and the omega-3 fatty acids, they use the same enzymes to produce further metabolites. And some of them are prostaglandins, some are leukotrienes, and some are lipoxygenases. So what you end up with then is two families of fatty acids, the omega-6 and the omega-3, using the same enzyme system to produce what is called, because there are 20 carbon atoms, they're called eicosanoids, some of which are prostaglandins. And so here you have then a food that in the body produces very powerful type of hormone-like substances called prostaglandins. And the omega-6 and omega-3, they have opposing properties. And in essence, they don't really communicate with each other because the prostaglandins and leukotrienes from omega-6 are prothrombotic and pro-inflammatory, where those from alpha-linolenic acid, ALA, are less thrombotic and less inflammatory. And through work that has been done by Dr. Serhan, we now know that some of the omega-3 prostaglandins, they go on and become the type of substances that are very anti-thrombotic and anti-inflammatory. And they're called pro-resolving lipid mediators. They're giving them another name. But in essence, in summary, the omega-6 and omega-3 have opposing properties. The omega-6 are pro-inflammatory, the omega-3s are less inflammatory. During evolution, they were in balance. So you never had the problem of eating a product that produced too much of the omega-6 metabolites and became pro-inflammatory. This came about once we began to change the fatty acids in the diet, mostly after the Second World War, because there was a need to have more calories. And so we ended up actually with high amounts of omega-6 fatty acids from corn oil and sunflower oil. Not only the fatty acids and the oils, but also the margarines. In addition to being prothrombotic, they also trans fatty acids, they form trans fatty acids when you use to fry, let's say, fish with sunflower oil. That's the worst thing you can do because fish is high in omega-3s and you don't want to introduce omega-6.
Yeah, so fried fish is a no-no.
So you can actually use olive oil or any monounsaturated oil to fry fish, if you're going to fry fish.
Oh.
So that in essence then, what happened is during evolution, there was a balance and we had equal amounts of omega-6 and omega-3s. With time and time changes, and particularly after the Second World War, we ended up with very high amounts of omega-6. So we have a diet that is prothrombotic and pro-inflammatory that never existed before in such large amounts, but only after the Second World War. So it's just like 80 days type, 80 years type of issue that has become something that we really need to have never done it.
Yeah, it's okay. That was beautiful. So can you put some numbers, like what the ratio you said historically was 1 to 1?
Okay.
Is there an acceptable ratio, and where are we living today?
Exactly. So during evolution then, people ate, they would hunt it for animals, they would fish in the lakes and rivers and sea. They would also go and pick up wild plants. This way, then, you ended up with a balanced omega-6 and omega-3 ratio, because many of the animals, they ate both leaves or grass, as well as seeds. And most seeds, you can think like that, most seeds are omega-6, more green leaves are omega-3s. And so they would balance each other. And a grass-fed animal has omega-3s, but a grain-fed animal, and most of the beef is grain-fed, are high in omega-6. So we went from a balance, because animals ate both grains and leaves, and then fish is high in in fish oils, which are the omega-3 fatty acids, EPA and DHA. So by eating this way, there was never an issue with the fatty acids. It's only through the food technology and the development of oils following the Second World War that increased the amounts of omega-6, so that instead, even in Greece, instead of olive oil, they're using sunflower oil. In Spain, people talk about the Mediterranean diet, but the Mediterranean diet had a balance ratio. The Mediterranean diet today does not have a balance ratio, because the vegetable oils are extremely common, because they're very cheap and easy to produce. You don't have to wait for a tree to grow to get olive oil. You can just plant twice a year and get lots of sunflower seeds or sunflower oil. So this is a very important issue. So the ratio was about either to completely balance, in other words, 1-to-1 omega-6 to omega-3, or 2-to-1, maybe a little bit more of the omega-6. Although in going way, way back in evolution, there was always more omega-3s, because people fished more, and they also lived along the seashore or the lakes and rivers. They really did not live in forests. So they had a lot more fish in their diet than later on. So the ratio today in Western diets, but also throughout the world, is about 20-to-1. You have 20 times as much omega-6 as omega-3. So you have a diet that is pro-inflammatory. Secondly, with ultra-processed foods, there is a high use of sunflower oil and corn oil. And even soybean oil is much higher in omega-6 than omega-3. So no matter which way you look at Western diets, particularly if they're ultra-processed, you have a high ratio of omega-6 to omega-3, leading to higher amounts of prostaglandins, leukotrienes, and at the same time, you have a much less production of the lipid mediators from omega-3s, which are very potent anti-inflammatory agents.
Perfect. And I want you to get into and where they live in our bodies in a second. But you said something really important, and I don't even know if I told you, but I'm part of this what's called the Beef Nutrient Density Project. And we're
Yeah.
looking at over 100 producers and in how they're raising their beef and the omega-6 to 3 ratio. And so it's clear that not eating enough fish and eating too many vegetable oils is definitely a part of the problem. But do you believe the way we raise our animals today is a significant contributor to this as well?
Yes, I think we have no business changing agriculture to the degree where you change the composition of the meat in terms of the meat fibers. An animal that is grass-fed does have some EPA and DHA. An animal that is grain-fed has zero omega-3s. It is all omega-6, which is linoleic acid and arachidonic acid. Now, you should also know that nature always provided for human beings. Mother's milk contains omega-3 fatty acids. In fact, when I was at the NIH, we came up with recommendations on the importance of omega-3 in infant feeding. They need to breastfeed or to use formula that contain DHA and smaller amounts of EPA. This was a major recommendation. Also, people noticed that in the Faroe Islands, where people eat a lot of fish, that they don't have as much premature babies born. So omega-3 fatty acids are essential to prevent prematurity, either before 34 weeks or before 37 weeks. And prematurity is a big problem because it is associated with differences in the rate of growth and development, as well as brain function. So that this change in the animal feeds is penetrating every part of our culture today. Yeah. In fact, just this month, a number of societies from Australia and Italy and Spain and Mexico, they went ahead and came up with a major recommendation that all women of reproductive age, they should make sure that they have adequate amounts of DHA in their diet. And all women who are pregnant and they seem to have a problem with prematurity, either they have a previous baby that was born premature or they develop preeclampsia, they are supposed to be getting as much as 1 gram of DHA. And there are studies that have been done that very clearly show that it cuts down on the prematurity rate. So when you look at it, then you can appreciate the fact that here are the fatty acids that we eat, that in the body, they are metabolized to very important prostaglandins, leukotrienes, and lipid mediators that affect every cell function because they are on the membrane of every cell in our bodies. And that's what makes it very exciting. I don't know of any other nutrient that's as important.
Oh, I love that. Yes, I'm a little bit obsessed with omega-3s, admittedly. And so just make this clear for us before we talk about the research and the ratio and what it's showing in terms of disease. So when we eat them, they're going into our cell membranes. How long are they living there? Can you explain that a little bit, or where else?
Well, it depends on the life of the cell, because red cells live 120 days, where white cells, they are about 40 days, and platelets are less than that. So how long they are on that cell membrane depends on the type of cell. And of course, they get into every cell and every cell membrane in the body.
And so do you, actually, I want to save that for after. We're going to talk about what you personally do, but take us through the research, because you've published a number of papers on this ratio and its risk or its increased risk for certain diseases. So can you take us kind of through the different papers that you've published and what you found about this ratio specifically?
Yes. Well, so the type of foods that are high in omega-3 fatty acids, you start with fish, because fish is very high in EPA and DHA, but the amount of EPA and DHA in fish varies with the type of fish. It's usually higher in fish from deep, cold ocean waters rather than tropical seas or seashores. And the most common fish that is high in omega-3 fatty acids, that also is not expensive, are sardines and herring. Of course, then comes salmon. Salmon is more expensive. Bluefish is less expensive. But any kind of fish that you can eat, but do not cook it or fry it in corn oil or sunflower oil. You don't want to more or less have any contact with these oils when it comes to fish. Then all green leafy vegetables, for example, watercress, arugula, Boston lettuce, or any kind of lettuce. And then, of course, all kinds of cabbage. They all contain omega-3 fatty acids of the parent type, alpha-linolenic acid, which in the body metabolizes to longer chain fatty acids. Now, when you come to linoleic acid, all grain-fed animals are high in omega-6. Sunflower oil is 80% omega-6. Safflower, about the same. Corn oil, 60%. Soybean is down less, about 30%, but still they all have ratios that are much higher, because remember, a lot of the ultra-processed foods, they contain a lot of omega-6, and then in most societies right now, they seem to fry everything.
Yeah.
And so every time you fry, you use these omega-6 oils, and you also develop trans fats.
Yeah.
There is no reason. Today we know how to make monounsaturated oils from hazelnuts, for example, which a lot of people produce in large amounts. And then avocado oil. Avocado oil is a monounsaturated oil. So you can use monounsaturated oils that are neutral, avoid the high omega-6 oils, and preferentially use the omega-3s. And this way, it's not that difficult. I say that, but I know that Dr. Marsden, when he was studying women that suffer with migraine, he tried to lower the migraine through dietary means and try to avoid in the diet as much of the omega-6. And in order to get a good metabolic product from the omega-3, you should have omega-6 2.5 or less percent. It's very hard to get below 3% in the American diet.
Wow. So yeah, I want to talk about how you do that specifically in a second.
Yeah, because it really, you have to eat a lot more vegetables than you do, a lot of green leafy vegetables than we do, and a lot more fish. And it doesn't have to be salmon that's expensive. It can be herring, or it can be sardines. And eat less meat, less red meat, because most of the red meat is grain-fed. And people are used to the taste and how it feels in the mouth, because a lot of the grass-fed meat is tougher.
Yeah.
And so people are getting used to grain-fed, and then it becomes difficult to transfer, I would say, your preferences from grain-fed to grass-fed, because it tastes different. And the
That's true.
mouthfeel is different.
Yeah.
Right.
And something like 70% of the beef on the market, like you said, is raised in factory farms and is grain fed. And also I wanted to say, herring is so delicious. I just got into these little cans of herring with pepper on them. It's like Barton Bay or something. It's absolutely incredible. So I highly recommend that. Now tell me, just so people can understand, these prostaglandins lead to the production of different types of mediators, messengers that either
Right.
promote or resolve inflammation. So what are some symptoms people would look for in their bodies that might let them know that this balance is out of whack? And also, what diseases might it increase the risk for? In your research, what have you found?
Yeah. Well, I think most people know that the ratio is not balanced,
Right.
because all they have to do is look what it contains. And if you have a list of oils and you know they're high in omega-6, you know very well that particular product is going to be high in omega-6. Ultra-processed foods are very high in omega-6. There was a study done at the NIH where they took 20 young men and in a metabolic unit with very, very extensive and precise studies. And for 2 weeks, they put them on an ultra-processed diet. And they said, okay, you choose to eat as much as you want, which was balanced with a diet they went on to the following 2 weeks, which was less processed or non-processed. And they saw major differences on the ultra-processed diet. You end up eating more.
Yeah.
Somehow stimulates the appetite center. So not only they ate more and they ate faster, but in 2 weeks, they gained 2 pounds, a pound a week. And when they switched the diets, the same people under the same conditions, but not ultra-processed foods, they did not gain the weight. So this is a very important study. They had not measured the omega-3. So I went back and recalculated. And I'll tell you, the ultra-processed had a ratio of 11:1, whereas the least processed or unprocessed had a ratio of 5:1. And remember, it's very difficult in this dietary environment to lower it. Now, if you are on a truly Mediterranean diet, you would not use any of these oils. You would use olive oil, and then you would eat a lot more fish than meat, because fasting in the Greek Orthodox Church does not permit eating so much meat before 40 days before Easter, 40 days before Christmas. Throughout the year, there are saints' dates. And so they have a diet that is more fish-oriented and less meat-oriented. And it's balanced because the olive oil that they use, it has a tiny amount of omega-6. It's not like the sunflower oil of 80%. So that I don't mean to say it's very easy. I think what's important is you need to know the composition of the food supply. I think you need to read the various labels. I think you owe it to yourself to know when you use oils, what kind of oils you use, what oils you don't use. And at the same time, in addition to a very good diet, you should really think in terms of exercise, because exercise, for example, has a beneficial effect, both in terms of making you feel much better. It affects brain metabolism. So things do not become a chore. You should enjoy what you're doing.
Yeah, I love that advice. We just got a rebounder here, and boy, are we enjoying the trampoline, and we do it a little bit. Yeah, just whatever puts a smile on your face.
Dancing and walking are the 2 easiest ways to exercise.
Yes, that's beautiful. And so I know in your I want to get onto what you're doing and how you're perfecting your ratio. But would we be thinking about heart disease? Is that just give us weight gain? Obviously, you said probably weight gain.
Okay.
What about cancer? Are there or mental health too? I'd love to. How do you think this ratio manifests
The
there?
moment you are on a Western diet, you are on a pro-inflammatory diet. Inflammation is at the base of all chronic diseases, including aging. So think in terms of cardiovascular disease, cancer. These are the two most common that people are worried about. And then the aging process. You can delay the aging process by keeping your weight down and become physically active. In fact, many of the metabolic changes that take place are very similar or reinforce each other with a Mediterranean diet and physical activity. And as I said, physical activity does not mean you have to endure and get pain in your muscles to get an effect. Physical activity can be a pleasure, walking in a park or swimming at sea or dancing. Really, I think that dancing should be part of public education.
I couldn't agree more. I love that we're on the same page there. And before I keep saying before, we're going to get to it, but I'm wondering, do you think having too few omega-3s or linoleic acid in excess, which is more dangerous or detrimental to the American public? Or is there one? Or are they the same?
Well, the trouble is this ratio that you just described, high omega-6 and deficiency of omega-3s, because we do have a deficiency of omega-3s, could not be a worse combination. There is no reason for anybody to use oils that are high in omega-6 fatty acids. I heard the other day that through fermentation, they're trying to remove the omega-6 fatty acids from the oils.
Wow.
Yeah, and this is all at the research level, but I think some people think that this is going to be something very helpful. But then you have to make sure nothing else happens during the fermentation process, because it's very easy by using naturally existing products to balance the ratio. All you have to do is remove what you have added.
Yes, exactly. And I know at the NIH, you had meetings in like 1985 where this idea kind of came alive, and in our American dietary guidelines, they don't really emphasize this ratio. And what do you think it's going to take to, and I know the word's getting out there, but to for our government to acknowledge the importance of this ratio?
Well, let me tell you, to begin with, more and more people are focusing on the ratio than ever before.
Yes.
And I can tell you, when my book came out for free, and you can download it, The Healthiest Diet for You, Scientific Aspects, it's amazing the number of people that downloaded the book and how many more people are citing the book. I wanted the book to be free, and try to stimulate people to read, because knowledge is power. So the dietary guidelines, these are people that want power under all circumstances. And I don't think they like to focus on the concept where you need to have a balance, because in order to do that, it's not easy to explain. Therefore, they totally ignore the balance. And this way, they try not to think about it. I think people who are knowledgeable and people who are curious and want to know what is in the food supply, I think they have no problem balancing their diet. I think we know that about 5-to-1 or 4-to-1 or less, you get beneficial effects. I mean, the Leonhardt study, it showed that with a ratio 4-to-1 or less, which is exactly what I had calculated from the diet of crept, you have no sudden death. And a tremendous decrease in the death rate, occurring with myocardial infarction and so on and so forth. So all the chronic diseases, there are about 10 of them that are the most common ones, okay? So you have heart disease, and you have cancer, and you have arthritis, and you have high blood pressure, then you have liver disease, metabolic liver disease. They do much better once they get on higher amounts of DHA.
Mm.
Not only they increase the death rate, but they also, what happens is they increase the rate of the aging process.
Mm.
And so if you want to stay young, and who doesn't,
Yeah.
the idea is to have a balanced ratio, fruits and vegetables, fish, little meat, and definitely nuts and beans, legumes in general, which is what this earth produces anyway.
Yeah. Perfect.
You don't need ultra processed food, because ultra processed foods are not made out of foods.
Right. Yes, exactly. And you see there's such a push for these vegetable oils as healthy and heart healthy, and actually reducing the risk of heart disease. What do you say when you come up?
All you have to do is go to a very first study that was done almost 60 years ago, and they put people on, they lower the saturated fat, and they put people on corn oil and lower cholesterol, but they didn't do the next step. Did that lower heart disease?
Mm-hmm.
And there is a lot of back and forth in the editorial section of journals about that 60 years ago.
Yeah.
So it's not anything totally new. If you go back and review carefully the literature, you will see there were signs very early where high amounts of omega-6 fatty acids are pro-inflammatory. They increase C-reacting protein, and the C-reacting protein is associated with increased heart rates and also heart disease. So there is plenty of evidence.
Yes.
So you've got to get to the public to understand and read and take responsibility for what they put into their mouth.
Beautifully stated. Now tell us, what are two things? There's new ways to test this ratio, right? Omega Quant. I don't know. Do you do any of these tests where you look at the ratio in your cell membranes, or have you heard about them? And then
Yes.
You've heard. Yeah. What do you think?
Yeah, well, let me tell you, the Women's Health Study, which is carried out at the NIH, they specifically have looked at the red cell membrane phospholipids, the amount of omega-6 and omega-3, which is the most accurate way to measure, rather than measure it in the plasma or measure it in the serum or through a dietary history. So red cell membrane phospholipids is the test that accurately measures the amount of essential fatty acid, both omega-6 and omega-3, on the cell membranes phospholipids. And those that had the highest amount of omega-6, they also, 10 years later, had the highest weight. So they followed them. So the increase in obesity, what everybody's talking about, Dr. Vanita Lee and I, in 1980, did the paper, Body Weight, Health and Longevity. And we pointed out what was going on in terms of the food supply and in terms of the oils, so that I'm glad you are doing this interview, because all I can emphasize over and over again, there is plenty of literature, very good papers on the evolutionary aspects of diet, because remember, our genes have not changed. Our genes have remained the same. They're programmed to respond to a diet and an environment which is consistent with evolution. Otherwise, they don't function.
Right. Perfect. Okay.
Yeah.
And the last thing I want you to do before you tell us where we can get your book and stuff, or what you're excited about and what you're researching next, is just tell us, if there was a few quick steps that you think would be the most impactful? We've talked about some already, but I'd like you just to put them in one soundbite. What are some steps people can take? And then I'd like you to take us through a day of the life in your meals. Like, what are you doing? Because clearly you've got this figured out.
Yeah. Well, I would say the most important aspect is to avoid ultra-processed foods and make yourself knowledgeable. Make a list. What are ultra-processed foods? There are a lot of lists out there. The ultra-processed foods are not made out of foods. Are they foods? So you ask the question. They're not foods. And unfortunately, they're cheaper. They taste very well because food technologists have learned very well to imitate flavor and taste. And so this is a very palatable food supply. A very palatable food supply leads to weight gain because it stimulates the appetite center. So there's just no way out of it except you need to know and you need to avoid ultra-processed foods. That's, I would say, in short, what one should remember all the time. In the book, we discuss foods to eat and foods that you don't eat, and various food components so that we don't give recipes, because you can use your own recipes as long as you use the healthy foods on the list. And people have no difficulty, following that. There is no problem. Now, you wanted to know what I do?
Yes.
First of all, I enjoy what I'm doing.
Clearly, yes, clearly.
Yeah, I mean, to me, it's very important. I don't really consider being a doctor or doing research at NIH or running the nutrition coordinating committee for the whole federal government. I didn't consider it a job. I actually enjoy very much what I was doing and what I am doing. As far as the diet, I am really strict the traditional diet of Greece, both in terms of what the fasting days, in terms of church, as well as the use of the traditional foods. In other words, eat a lot of legumes, a lot of salads, a lot of soups, a lot of fruit. I probably eat more fruit than salads. And I was in Greece for Easter in May, and I enjoyed all the fresh fruit. You just picked it off the tree, and it tastes so good rather than getting from a supermarket. And most of the time, I really don't like them, but I eat them because I know they're good for me.
Yeah.
Then I always liked dancing, and I always liked walking. And I am not a good skier, mostly because I grew up in the southern part of Greece and we never had any snow. It was mostly swimming and dancing.
Perfect. Well, clearly. And what about supplements? Do you think omega-3 supplements are a good idea?
Yeah, well, let me tell you, ideally, you could do very well on the traditional diet of Greece. It's not, I don't like to call it Mediterranean because it's really a geographic term. And not all Mediterranean countries have the same diet, but it's a term that people use. I would say that overall, having a good diet depends entirely up to the individual. In Western societies, you're not going to be told or even helped because the emphasis is on the economics, and ultra-processed foods are cheaper.
Yeah.
Being on a Mediterranean diet is a little bit more expensive, but you can eat less. You can balance that by eating less and maintaining a weight, a body mass index under 25, between 23 and 25. There's no question about that. But as far as the dietary recommendations, I think they have to think differently. They have to start thinking in terms of a balance, like we're thinking of ratio when it comes to calcium and phosphorus, when it comes to sodium and potassium. It's not that other parts of the human body don't have balance in their various elements, because you can decrease your omega-6 and increase your omega-3s and go to a balance.
Great. Do you think for...
So you avoid omega-6, increase omega-3, you automatically, I don't know if you're going to get a ratio of 2:1. It's very hard to get a ratio 3:1, but we know a ratio 4:1 is very beneficial, because the Leonhardt study showed very clearly people who had one episode of heart disease, they lived the longest under a ratio of 4:1.
Perfect. And I know diet is obviously the first way to do that. Do you think people could supplement with fish oil too, or would you prefer diet? Yeah.
So most of the studies that have been done, clinical studies, have been done with supplements.
Yeah.
And when you take a supplement, you take it every day, which actually gives you a good ratio or omega-3 level on a daily basis. If you're going to eat fish twice a week and the rest of the week you use all your ultra-processed foods, it's not going to help you.
Yeah.
So eating fish twice a week is not as helpful as taking supplements. I take supplements.
You do? Okay.
Yeah.
What kind do you take and how much?
1985, when we had the major conference at the NIH, all of us who were organizers of the conference, and I chaired the conference, after that, all of us went on omega-3s because we were convinced, number one, the fish here is, I don't know how it is where you are, but to get fresh fish is not as easy. Most of it is actually cultivated. Cultivated fish has less omega-3s than fish in the wild. So to get wild fish, it's not as easy. So under ideal circumstances, you change the oils, you focus on eating more fish than meat, you eat a lot of legumes, but at the same time, you should be checking your omega-6, omega-3s, and you should be checking the ratio and make the appropriate changes either through diet or through supplements. But the best results are supplements because we are having the omega-3 deficiency situation throughout the West.
Yeah. And how much do you take a day? How many milligrams or a gram, or what's your dosage like?
Well, I take a gram a day. And I should tell you that for women who are pregnant and there is a question of premature birth, they recommend up to 1 gram a day. And up to 1 gram a day has never been shown to have any problems. Otherwise, you wouldn't have a dozen societies recommending it to prevent prematurity.
Perfect. And does the balance of EPA and DHA matter, or do you just take equal amounts of both?
Well, let me tell you, this is a very important question, but most people think that you have a higher amount of DHA than EPA, but the data for one or the other are not really that good. You can have equal amounts because some fish have more EPA, other fish have less EPA. So if you look at the natural way of getting your omega-3s from fish and diet, it varies. As long as you have, you know, about a gram a day, like 400 milligrams of one and 600 of the other, or equal amounts. That varies the same way that nature varies and fish varies.
Yeah, perfect. I love that approach. Now, last question is, what's next for you? What are you excited about, and where can we find your book and download it and let people connect?
Let me tell you, when I wrote the book because I wanted people who are interested to read it, and they don't have to worry about paying for the book or how to get it. And so it's been downloaded free, and the publisher is MDPI. And the name of the book is The Healthiest Diet for You, Scientific Aspects. And my name is Artemis P. Simopoulos. I no longer have to spell, by the way, Artemis, because of the rocket that they have, still has not gotten to space. But you know, Apollo is one rocket and the other is Artemis, because it's a twin sister of Apollo. So I no longer have to spell my name.
Beautiful.
Now for people who, you know, because there are people who don't like to download, they like to read books. There is also a hardcover for the book, and right, I think, where it online, where it says how to get it, to download it, it also tells you that the hardcover, to get it from MDPI, the publisher. And I'm not sure exactly how much it is right now. I think it's $83, because it's written more like a textbook. It's not a cookbook.
Okay. Well, I will be getting that book. I read your first book, the one you wrote in the 90s, and loved it. So I highly, highly, highly recommend everyone go download that. And then, did you think that there's anything we missed, or any new projects you're working on that you want to tell us about? Any last words of wisdom?
Well, I really now want to continue to give presentations and try to get to reach as many people as I can, because I know for a fact that human beings are motivated to do what's best for them, provided they have the knowledge. Yeah. And again, knowledge is power and can overcome the economics.
Well, thank you so much, Dr. Simopoulos. This is one of my favorite interviews ever, so I really, really appreciate your time. Everyone go check out her book and get to minding this ratio, because it could literally change your life and make you age better, prevent disease. I mean, there's no reason not to. So thank you, Dr. Simopoulos.
Well, thank you very much. I appreciate that.
Yeah, this was amazing.